Good afternoon, everyone. My name is Julie Parker. Thank you for joining us here. It is July 1st, and we have been doing these weekly Wednesday media briefings here on Zoom since April. So thank you for taking the time for the members of the media to join us, as well as the many members of the public who join us each and every week. We are also going to be streaming live on Facebook. As always, reporters, if you need to have the ability to record, please reference that in the chat box. And also, if you have a question for either County Executive Elrich, Dr. Gales, or Dr. Stoddard, please indicate in the chat box the general nature of your question and also who you are directing that question towards. And then we will call on you in order. So we're going to kick it off this afternoon with the County Executive who would like to share a few words.
So welcome everybody, and thank you for joining us in this briefing. I do want to share a few words with you and talk a little bit about where we are with the virus right now. I think some of you probably read the New York Times and you've seen they're running a daily report on coronavirus in the United States. And Maryland is right now one of two states, along with the District of Columbia, that have a declining number of cases. And I've got to say that, you know, I take a lot of pride in the work that's been done with Prince George's County and the District of Columbia and with Northern Virginia to coordinate as best we can a slow reopening to make sure that whatever we do safely. And as you can see around the country, there are enormous spikes in this virus occurring. The CDC has said this is out of control. And we're not going to go out of control in Montgomery County. We're going to do what we need to do and continue to work with our partners to make sure that we stay safe. As part of that, you know, we've opened up our more of our businesses. We've had this ambassadors program, and we've reached more than 2,000 businesses to educate them about the requirements for reopening. We check the checklist, make sure they understand what they need to do. The overwhelming majority of businesses follow the guidelines. We've had some that we've had to talk to, and I want to make something perfectly clear. Businesses will stay open as long as they follow the health guidelines. If they are not following the health guidelines, they'll be closed, because we can't afford to let some few number of businesses that don't want to follow the guidelines jeopardize everybody else's ability to stay open, which depends on our ability to control the spread of COVID-19. So we're going to enforce it. Well, we want people to open up, but we want people to open up safely. We want them to protect their employees. We want them to protect the public. And we want individual workers to protect themselves and individual customers to protect themselves. We're all in this together. We got as far as we did because we adhered to a set of guidelines, and this is not the time to let up from that. On the testing front, we've got, you know, 3 drive-through testing sites open 4 days a week. We did our first pop-up test center this week. We're opening more pop-up testing. So you'll see more tests occurring around the county. We've covered over 91,000 residents. We've given out well over 100,000 tests, and we're continuing to grow that number. In addition to the opening of businesses and restaurants, you'll see that Montgomery Parks is reopening playgrounds and sports facilities. There are still restrictions that apply. Our libraries will be providing limited services soon, and the county pools will also open soon. We begin a program to provide assistance, financial assistance, to our child care providers. We understand that it is absolutely critical that for workers to go back to work, they're going to need childcare. And if we cannot open the childcare centers, it's hard to expect parents to leave their small children at home alone. So it's critical that we get the childcare centers reopened. We could use more help from the state. This is not just in Montgomery County's interest, this is in the state's interest. So hopefully more help will be coming and we'll be able to expand what we do. Earlier this week, I spoke before the General Assembly's Environment and Transportation Committee about the many people who may be facing evictions after the governor's moratorium ends. We expect, if the moratorium ends at the end of July, to start seeing, I believe they said on the report yesterday, courts taking up evictions, repossession cases at the end of August. We literally have tens of thousands of households that are in danger of being evicted. And we are hoping that landlords think twice about doing that, because if you evict people who have no income, it's not quite sure that you're going to replace the large number of people who haven't had the income to pay the rent up to now. We encourage them to work with the tenants to work out payment plans or partial payment plans. I think everybody's got to be cognizant of the limited resources that people who are out of work have, but it's absolutely essential we do this. It will be a major, major issue if we get that level of displacement in the county. We're also working on a 4th of July celebration. So we're going to have a TV program, and we have local musicians who are going to perform, and there'll be fireworks on there. I've told people to turn up the volume on the TV so you can fully enjoy the fireworks. They're meant to be heard loudly, I believe. And also remind people that fireworks are dangerous, and that fireworks are not allowed in Montgomery County or the state of Maryland. And also think about large crowds can be dangerous too. So if you're going to gather with friends, please adhere to social distancing or physical distancing. Please wear face coverings. And please, if you're going to join together with people, do it outside rather than inside, because it's safer. As I said, the pools will be reopening soon. It won't be wading pools, or what they call baby pools, but slides and diving boards will be available. And the COVID-19 Corps, we had 1,300 people apply. We've got 75 vacancies left. And we're going to continue to look to see what we can do to actually expand that program and provide more opportunities. And if people are interested, they can apply through the iRecruitment system. So stay tuned, there's more to come, and I'll wait for questions.
All right, thank you, Mr. County Executive. Dr. Gales, do you want to kick us off with a few public health remarks?
Sure, I'll keep it brief to give more time for questions, but always a pleasure to be with you all, and hope you're continuing to stay safe. And in addition to monitoring physical distancing and wearing your face coverings, given the heat index, making sure that you stay hydrated and also wear your sunscreen. All right, with that in mind, I do want to address one point before moving to questions. We have continued to see improvements in our data. Our daily case counts have seemed to plateau in the mid-60s, which in context of increased testing is a good thing. I mean, certainly we want to see those numbers continue to move downward, but when we're seeing new cases in terms of 60 to 65 new cases a day, when we're testing several thousand individuals a day, our test positivity continues to come down. Those are encouraging signs. Just to level set, where we were at the beginning of June 4th, our 3-day average was 255 cases a day. Our 3-day average as of this morning is 65 cases a day. So we've made significant progress in containing the virus, but we still have a long ways to go. And certainly before we begin to have conversations and discussions about moving to next phases, we want to make sure that we continue to drive the impact of the virus down even more. Now, part of the things that are factoring into that and influencing that are our own internal county dynamics. We're continuing to increase testing to get as many people tested as possible, to identify cases as quickly as we can, to effectively get them isolated, building on our contact tracing system. But we also are watching and paying very close attention to what's happening in other jurisdictions. You know, there have been a number of states that have seen significant increases in daily cases impacted by reopening very early or not having as many strict precautions in place, such as the face coverings and physical distancing. We have seen the impact of that across the board, but it has also disproportionately seemed to impact young people. If you recall, in the very beginning of COVID-19, we talked about how this could disproportionately impact and hurt older residents, but the new data suggests, and it hasn't more not necessarily in Montgomery County, because fortunately our case counts have dropped significantly. But we do see trends across the country and trends across the region where we do see a higher percentage of cases popping up in the younger categories, 0 to 17 and 17 to 29. And not only do we see more cases popping up there, we also are starting to see a higher percentage of those young people have significant complications related to COVID-19. Now, there are a couple of reasons behind that. One is lots of young people have gone to beaches. They've gone to high capacity events that have broken the capacity rules, where they've mixed and mingled with other individuals and other young people. And a large part of that bears out of the sense of, as an adolescent physician, as an adolescent medicine physician, not an adolescent physician, I passed that age a long time ago. But it does bear out of the sense of, young people do have a sense of invincibility where, because all of the literature suggests that even if they get it, well, one, the literature has shown that they don't get it, but even if they get it, they're less likely to have consequences, both in the short term and long term. And the reality is we don't know what the long-term effects are and impact. And so that's why we want to make sure that parents at home understand that it is not safe to have kids going out, loosely and freely, and making sure that when they do, they follow the same precautions that we are following as adults, including wearing face coverings, minimizing contact with others outside of your social network, and making sure to maximize physical distancing as best as possible. I'll stop there. Happy to answer any questions.
Thank you, Dr. Gales. The first question will be coming from Brianna from Bethesda Beat, and she's got a question for you regarding phase 3.
Hi, thanks for being here. So I did want to ask about phase 3. I know when we moved from phase 1 into phase 2, you took 2 weeks to look at the data and reevaluate. Friday marks 2 weeks that we'll have been in phase 2. Do you expect you're going to reevaluate on Friday? And is Monday the earliest that we could potentially move into phase 3?
So let me actually clear it up for you. I think we said when we moved into phase 2, and to borrow Julie's term, level set, that we would at a minimum 14 days, but we were not wedded to that. And the 14 days stems from the CDC criteria that says before considering moving to a next phase, at a minimum, you should have 14 days of data in one phase to demonstrate improvements before moving forward. Now, so part of the challenge for us is, yes, we've seen improvements, but, when we look at the new cases, they have kind of plateaued a little bit. We're hanging out in the 60s. And, we want to see more improvement from that level before, again, we feel comfortable opening up more activities to folks. And the reason why that's done is because as you look at what has opened from phase 1 to phase 2, and will continue to open, we're increasing capacity limits, and we're increasing activities that increase the potential contact points for folks coming into contact with other people, which could mitigate, which could increase risk of transmission. So those are the factors that we're looking at. I can say right now we evaluate this on a daily basis, particularly because we're seeing so much evidence from other jurisdictions who have moved forward past us into other phases and have had significant issues with the numbers going back up. So I would say that we're going to continue to follow the data. We're going to continue to see how we move forward. And as the data suggests, particularly in this phase, that would determine, when we start introducing and thinking about moving forward. So I can tell you that it's not going to happen on Friday. We're not going to move to phase 3 on Monday. So I'll put that out there to save further questions, because right now, all of the data suggests that, I think everybody across the country is taking a step back and pausing to see what's going to happen, to determine if the influx of new cases in these other areas impact us. Also, coming up this weekend, we have a holiday. And so, what's going to be the impact of folks traveling on the holiday, whether they're going to beaches or going to other jurisdictions, and then coming back home. So I say all of that to say that we reflect every day, even more so now given the current climate, and we'll continue to do so, but no imminent announcements in terms of moving to phase 3 are coming at this point.
And I want to add to that real quickly. Just to make next week's question easier, next Wednesday, we won't be telling you we're reopening yet either. We are going to wait till we've got at least a week from this weekend to make sure we don't see a spike in cases. So assuming a lot of people go to the beach, not just county residents, but people county residents know, we want to make sure that we do not get a spike next week. So we'll know better how the weekend played out in about a week from, little over a week from now. So we'll be discussing this on the weekend, next weekend, and we'll move forward as appropriate. Hopefully the numbers will be good, and hopefully residents will pass on going to the beach this year and find great things to do in Montgomery County, and to walk in our parks, and to, hang out in your yard because you don't have to work. But, going to the beach may not be the best thing.
Okay. Matt Blitz from DCist and WAMU has a question for Dr. Gales about testing capacity.
Yes, thank you. In mid-May, the hope was to ramp up county testing to tens of thousands per week. With currently 3 testing sites with select hours and days of the week and 1 pop-up site, how many tests is the county currently executing a week? With cases surging in other states, as you mentioned, how does the county plan on meeting the increased testing needs that may come with that? And will there be more testing sites established soon?
Sure, that's an excellent question. And again, to borrow Julie's term, let's level set. So as of this morning, in terms of tests that we've offered, we are averaging around 1,600 tests across the county on a daily basis. And that gets us to, you multiply that by 7, that gets us to over 10,000 tests run in the county on a weekly basis. To date, we have run over 109,000, we've collected over 109,000 specimens, which outpaces any other jurisdiction in Maryland, Virginia, and DC. We have tested almost 93,000 residents, which is 8.8% of our population. Now, in terms of what we have available, so in addition to that, we've had more than 3 sites available just 3 days a week. In fact, we have 3 sites. We've increased, so now that those alternative sites, we have a site open at least 1 day a week, even on Fridays now. We have brought in volunteers to help support a mobile testing arm, which has gone out to homeless shelters, as well as to some of our group homes since the beginning of last week to provide additional testing. As the county executive mentioned, we also have started standing up pop-up testing that utilizes our self-collection mechanism. We had a successful event last week where we tested over 430 individuals in a 4-hour period at Tacoma Park. We are meeting with numerous community organizations. In fact, we have contacts within 15 different groups that we are currently working with to stand up and partner with them to do testing, as well as identifying other large venues throughout the county to do pop-up testing in community venues, as well as opportunities to do walk-up testing in different places to address the concerns that have been raised about transportation access for many others. I also want to highlight that it's also part of that working strategy, recognizing that not everyone had access to a provider. We created a mobile helpline that created a standing order, and what will also be exciting about the pop-up tests that are coming online is that we won't require an order for that. Individuals will be able to register and get asymptomatic as well as symptomatic, be able to get access to testing. Now, we recognize certainly that we were working to push this out faster. We aren't saying that, yes, we've reached our goal and we're resting on our laurels. We want to very actively and aggressively get out and test as many folks as possible. And the collective efforts of all of the things that I just mentioned will help us continue that goal of 10,000 a week, but we want to get to where we're testing even more folks and creating access points for more individuals to get a first test. But certainly we recognize for others, for example, our essential employees and first line responders may need to get tested more frequently. And so we are infusing all of these opportunities into our community to make sure that our residents have access to do all of those different things.
Dr. Gales, it looks like our last question is from Isabel Cleary with MyMC Media. This is regarding potential COVID scams. Isabel, go ahead and ask your question of whomever you'd like to. Dr. Stoddard, who oversees our Office of Emergency Management and Homeland Security, is also with us today.
Hey, thank you so much for your time. So on June 26th, the FBI published a press release warning about the potential scams related to COVID-19, including people marketing unapproved COVID-19 antibody tests or trying to obtain individuals' personal information through trying to get them to sign up for these tests. Have there been reports of this in Montgomery County? And if not, or if so, how should residents protect themselves from these types of scams?
I'll take a step. So we have an Office of Consumer Protection who's working throughout this event. I'm not aware of any specific targeted efforts on Montgomery County residents, but with a population of over 1 million, it's, you know, since the beginning of this event, I'm quite confident that some of our residents have been targeted at some point. If they do have concerns, they can certainly reach out to our Office of Consumer Protection. They are still working even throughout the pandemic. Much of their work is remote, but they are doing follow-up investigations and all those things that they need to do. And so we certainly are very interested in our residents being protected. And if they are concerned about anything where someone reach out to them for personal information, do not provide it before consulting with our Office of Consumer Protection, and then we can go forward from there. We are aware of the bulletins that have been posted by both the FBI. Our State Fusion Center has provided us other ones of targeted efforts to try and get personal information, or utilizing COVID-19 as a Trojan horse to try and get into people's computers and devices. And so we are aware of those things going on, and we are monitoring them through our law enforcement partners. But if our residents are concerned, they should certainly contact Consumer Protection.
Thank you, Dr. Starr. Stand by, because Brianna has a question either for you and or the county executive regarding CARES Act funding. So Brianna, you're back up.
Yeah, thanks. So I did have a question about CARES Act funding. I know the municipalities have requested some of that funding, and they were told that there was going to be an application portal that would be opening. I was told by them yesterday that that hasn't been opened yet. When do you all expect for that to be open? And have there been any discussions about a specific amount that will be set aside for them? And then if I could sneak one question in, I know County Executive Elrich, you had mentioned that county pools would open soon. Is there any better target of when you all expect those to open? Oh, you're muted.
Mark, you're muted.
Yeah, soon sounds really good. It's, better than not at all. We're moving that direction. We have to bring on the personnel. We did not, spend the money early to get pools ready because we didn't know if we were going to be ready. There was a point when none of us thought we'd even be thinking about opening pools this summer. I think in part because we were able to manifest some degree of control over the spread of this. That became a more realistic option. But early on, we weren't thinking about that. And for us, we've got to bring back staff. These are not people who are working year round, particularly in the outdoor pool world. They're there when we need them for a pool. So we're hiring up, we're preparing the pools so they're ready to operate, and it will open. And I do think it'll be soon.
And on the CARES Act piece, I don't know, Brown, if you're have a camera on me or something, but I just texted with while we're actually on this call, I texted with our Department of Technology Services to try and get an update on where exactly the portal is. We had the portal live, well, not live, but we are in testing. There were some issues with the saving of documentation. As you know, we've got to be able to survive an audit from the federal government with all the CARES Act funding. And we want to make sure that we have a good portal that saves the data, because if we have to come back under audit and defend what was spent, we need to have the proper documentation. And so there was some issues with the saving of the materials. And so we had to go back and redesign a little bit of the back end. So it's taken a little longer than we had hoped. And also, I mean, just the reality is our Department of Technology Services is doing a lot right now to try and get things digitized, get them online, building the COVID website, building the new business grant process, building the child care application process. And so there's just a lot going on right now that is pulling them in many different directions. We expect to have this online application ready very, very soon. There is a paper version that they can apply for already, the municipalities, including Maryland National Park and Planning Commission, WSSC, and others can apply through the same portal. We have not set aside a specific amount of dollars because we want to see what we can get reimbursed from FEMA first. Our strategy has been, as a county, and the same is true of our municipalities, that we want to leverage every possible dollar we can for Montgomery County residents. And the way that we do that is to seek reimbursement through FEMA first. Whatever FEMA will not reimburse, the county will cover on the back end as it relates to COVID-related costs that we can, recompense our municipalities for. And so right now, many of our municipalities are just in the process of requesting to FEMA and getting answers on what they've incurred. We've already gotten some affirmative answers. I know Tacoma Park has gotten several projects approved. I know Gaithersburg and some of the other municipalities that are in the process of applying for or have already gotten answers. And so we have not, number one, we haven't spent all the money. And so there is no, huge time pressure for the municipalities to apply per se. And we have not set a specific amount because we're going to cover the costs associated with what they incurred.
Thank you, Dr. Stoddard. And Shanikia from WDVM has a question regarding gatherings, probably specifically for this holiday weekend. Go ahead.
Hi, everyone. This question just goes to anyone who can answer it. Are gatherings still limited? And what do you say to those people who may be considering having cookouts or parties for the weekend?
I think the first is will we be getting a plate when they order it? I'm kidding. No, so our gathering limit is still in place. We have put a cap of 50 in for our social gatherings for Montgomery County residents. If individuals are going to do events where they invite others over, we encourage them again to follow the same practices that we've been preaching in terms of wearing face coverings, minimizing points of contact when you're in those settings, promoting physical distancing within those spaces, making sure to wash hands as much as possible and have provisions, whether it's hand sanitizer or soap and water, to make sure that people are able to do that. I think those are the biggest practices that we can put into place and encourage. If folks are going to do it, now certainly we would prefer that they keep gathering small within your networks your regular networks of communication and contact. But certainly if there's going to be inviting folks over into spaces, physical distancing, face coverings, and frequent hand washing at a minimum.
Anything else to add? If not, that was our last question of the afternoon. We appreciate you all joining us. Any closing remarks from any of our speakers?
I just hope everybody has a safe holiday and that you get the opportunity to enjoy something and take a break from all of this. And I think everybody can use some perspective on life beyond life as defined by COVID. So have a good weekend, everybody.
Thanks everyone for joining us, and have a safe and healthy holiday weekend. Take care.